Page 31, Study Suggestions for Candidates Preparing for the Written Examination. It is NARM's expectation that all midwives who have accrued the required levels of experience and who have diligently prepared will be able to pass the NARM examination. We acknowledge that many factors affect a person's ability to pass a written examination and that even very experienced midwives may experience test anxiety. We therefore offer these suggestions for preparing for the NARM examination. 1. Allow time to prepare for the examination. Even experienced midwives will benefit from a review of the reference books. Reading and studying will help prepare the candidate to more effectively evaluate examination questions and answers. 2. Get a good night's sleep before the examination. You will not have an opportunity to eat before noon, so should nourish yourself before beginning. 3. If you experience test anxiety, work on relaxation exercises while you study. Plan a schedule for study so that you don't feel that you are cramming right before the test. Give yourself time to relax the day before. Remember that if you do not pass the examination on the first try, you may take it again at another time. 4. The NARM reference list contained in the Candidate Information Booklet lists over 20 books for study. Read as many as you can. Strive for a good balance of the medical and midwifery sources. If you are limited on time and/or resources, read the ones that supplement your general knowledge rather than reinforce it. The NARM examination strives for a good balance of midwifery knowledge. 5. Utilize the information in your Candidate Information Booklet, especially the test specifications, the reference list, and the sample questions. 6. For those candidates whose first language is not English, it might be helpful to focus on activities that will enhance verbal skills and reading skills. Such activities might include attendance at midwifery association meetings, participation in study groups, and observation of local out-of-hospital midwives who provide prenatal care or teach childbirth classes. 7. As you are reading, try making 3x5 index cards with questions on each side and answers on the other. Use the cards to quiz yourself. Page 32. NARM examination test specifications. The test specifications were developed from a recent job analysis which was based on the Midwives Alliance of North America, MANA, core competencies. NARM strongly urges all candidates to thoroughly review the NARM examination test specifications and their associated reference list to prepare for successful completion of the CPM, certification examination process. NARM considers the test specifications to be the essential curriculum for entry-level midwives. CPM NARM examination matrix. Domain, first column. Percentage of exam questions, second column. Number of questions, third column. 1. Domain. Professional issues, knowledge, and skills. Percentage of exam questions, 4 to 6%. Number of questions, 12 to 18. 2. General health care skills, 4 to 6%. 12 to 18 questions. 3. Maternal health assessment, 8 to 12%, 24 to 36 questions. 4. Prenatal, 23 to 27%, 69 to 81 questions. 5. Labor, birth, and immediate postpartum, 33 to 37%, 99 to 111 questions. Postpartum, 13 to 17%, 39 to 51 questions. Well baby care, 4 to 6%, 12 to 18 questions. Written test specifications. Reviewed 2017 for exams taken after January 1st, 2019. Professional 1. Professional issues, knowledge, and skills. 5% of exam, 12 to 18 examination items. A. Applies understanding of social determinants of health, income, literacy, education, sanitation, housing, environmental hazards, food security, common threats to health. B. applies understanding of direct and indirect causes of maternal and neonatal mortality and morbidity. C, understands principles of research, evidence-based practice, critical interpretation of professional literature, and interpretation of vital statistics and research findings. D, provides information on national and local health services such as social services, WIC, WIC, breastfeeding, substance abuse, mental health, and bereavement. E, educates about resources for referral to higher health facility levels, appropriate communication, and transport mechanisms prepared for emergencies. F, knows legal and regulatory framework governing reproductive health for women, including laws, policies, protocols, and professional guidelines. G, applies understanding of human rights and their effects on the health of individuals, including 1, domestic partner violence, 2, female genital cutting, 3, cultural effect of religious beliefs, 4, gender roles, 5, other cultural health practices. H, facilitates mothers' decision of where to give birth by discussing 1, advantages and risks of different birth sites, 2, requirements of the birth site, 3, how to prepare and equip the birth site. I, participates in peer review for maternal and neonatal mortality or morbidity. 1, understands the purpose of peer review. 2, understands the process of participating in peer review. J, understands the application of professional ethics, values, and human rights. 1, understands and applies the principles of confidentiality in relationships with clients and students, including applicable components of HIPAA. 2, understands the process of shared decision-making with clients throughout pregnancy and birth. 2, general health care skills, 5% of exam, 12 to 18 examination items. A, demonstrates the application of universal precautions as they relate to midwifery. 1, hand washing. 2, gloving and ungloving. 3, sterile technique. B, educates on the benefits and contraindications of alternative healthcare practices, non-allopathic treatments and modalities, including herbs, hydrotherapy, water birth, chiropractic, homeopathic, and acupuncture. C, understands the benefits and risks and recommends the appropriate use of vitamin and mineral supplements, including prenatal multivitamins, vitamin C, vitamin E, folic acid, B complex, B6, B12, iron, calcium, magnesium, probiotics, and vitamin D. D, demonstrates knowledge of the benefits and risks and appropriate administration of the following pharmacological prescriptive agents. 1, local anesthetic for suturing. 2, medical oxygen. 3, methergin. 4, prescriptive ophthalmic ointment. 5, Pitocin for postpartum hemorrhage. 6, Rogam. 7, vitamin K oral or IM. 8, antibiotics for group B strep. 9, IV fluids. 10, Cytotec, misoprostol. 11, epinephrine. Page 34, written test specifications continued. E, demonstrates knowledge of benefits/risks of ultrasounds for indications such as pregnancy dating, anatomy scan, AFL, fetal well-being and growth, position and placental position, and determination of multiples. F, demonstrates knowledge of benefits/risks of biophysical profile, including counseling and referrals. G, demonstrates knowledge of how and when to use instruments and equipment, including 1, amnio hook. 2, bag and mask resuscitator. 3, bulb syringe. 4, DeLee tube mouth suction device. 5, hemostats. 6, lancets. 7, nitrazine paper. 8, scissors, all kinds. 9, suturing equipment. 10, straight in and out catheter. 11. Vacutainer/blood collection tube. 12. Gestational wheel or calendar. 13. Newborn and adult scale. 14. Thermometer. 15. Urinalysis strip. 16. Cord clamp. 17. Doppler. 18. Fetoscope. 19. Stethoscope. 20. Vaginal speculum. 21. Blood pressure cuff. 22. Oxygen tank, flow meter, cannula and face mask. 23. Pulse oximeter. 24. Laryngeal mask airway, LMA. H. Proper use of injection equipment including syringe, single and multi-dose vial/ampules, and Sharps container. I. Obtains or refers for urine culture. J. Obtains or refers for vaginal culture. K. Obtains or refers for blood screening tests. 11. Evaluates laboratory and medical records with appropriate education and counseling of client, including 1. Hematocrit/hemoglobin. 2. Blood sugar (glucose). 3. HIV. 4. Hepatitis B. 5. Hepatitis C. 6. Rubella. 7. Syphilis, VDRL or RPR. 8. Group B strep. 9. Gonorrhea culture. 10. Complete blood count. 11. Blood type and RH factor. 12. RH antibodies. 13. Chlamydia. 14. Pap test. 15. Vitamin D. 16. Thyroid panel. 17. HbA1c. 18. Genetic screening. 19. Blood albumin. 20. Complete metabolic panel. 21. Progesterone. 22. HCG. 3. Maternal health assessment. 10% of exam. 24 to 36 examination items. A. Obtains and maintains records of health, reproductive, and family medical history and possible implications to current pregnancy, including 1. Personal information / demographics, including religion, occupation, education, marital status, and economic status. 2. Increased risk for less than optimal outcomes due to allostatic stress from racism and resource scarcity. 3. Changes in health or behavior and woman's evaluation of her health and nutrition. 4. Potential exposure to environmental toxins. 5. Medical conditions. 6. Surgical history. 7. Reproductive history, including A. Menstrual history. B. Gynecologic history. C. Sexual history. D. Childbearing history. E. Contraceptive practice. F. History of sexually transmitted infections. Page 35, written test specifications continued. G. History of behavioral risk factors for sexually transmitted infection. H. History of risk of exposure to blood-borne pathogens. I. RH type and plan of care if negative. 8. Family medical history. 9. Psychosocial history. 10. History of abuse. 11. Mental health. 12. Mother's medical history. A. Genetics. B. Alcohol use. C. Drug use. D. Tobacco use. E. Allergies, environmental and medical. F. History of vasovagal response or fainting. Vasovagal response or fainting. G. Foreign travel history. H. Vaccination history / status. 13. Father's medical history. A. Genetics. B. Alcohol use. C. Drug use. D. Tobacco use. B. Performs a physical examination including assessment of 1. Size of uterus and ovaries by bimanual exam. 2. General appearance, skin condition. 3. Baseline weight and height. 4. Vital signs. 5. HEENT. Heat, head, eyes, ears, nose, and throat, including thyroid for palpation. 6. Lymph glands of neck, chest, and underarms. 7. Breast, including mother's knowledge of self-breast exam techniques. 8. Torso, extremities for bruising, abrasions, moles, unusual growths. 9. Baseline reflexes. 10. Heart and lungs. 11. Abdomen by palpation and observation for scars. 12. Kidney pain, CVAT. 13. Deep tendon reflexes of the knee. 14. Condition of the vulva, vagina, cervix, perineum, and anus. 15. Cervix by speculum exam. 16. Vascular system, edema, varicosities, thrombophlebitis or phlebitis. 5. Prenatal care, 25% of exams, 69 through 81 examination items. A. Provides appropriate prenatal care and educates the family of significance. B. Understands and educates about the anatomy and physiology of pregnancy and birth. C. Understands normal and abnormal changes during pregnancy. D. Assesses results of routine prenatal exams, including ongoing assessment of 1. Maternal, psychosocial, emotional health and well-being, signs of abuse. 2. Vaginal discharge, including signs and symptoms of infection. 3. Social support system. 4. Maternal health by tracking variations and changes in A. Blood pressure. B. Weight. C. Color of mucous membranes. D. General reflexes. E. Elimination, urination patterns. F. Sleep patterns. G. Energy levels. H. Nutritional patterns. Pica. I. Hemoglobin, hematocrit. J. Glucose levels. K. Breast conditions, implications for breastfeeding. 5. Number 5, not Roman numeral. And correction, I am on Roman numeral 4. And number 5, assesses urine for A. Appearance, color, density, odor, clarity. B. Protein. C. Glucose. D. Ketones. E. pH. F. Leukocytes. G. Nitrites. H. Blood. I. Specific gravity. 6. Estimates due date based on standard methods. Page 36, continued. 7. Written test specifications, continued. 7. Assesses fetal growth and well-being. A. Fetal heart rate tones oscillated with fetoscope or Doppler. B. Correlation of weeks gestation to fundal height. C. Fetal activity and responsiveness to stimulation. A. Fetal palpation for A. Fetal weight. B. Fetal size. C. Fetal lie. D. Degree of fetal head flexion. 9. Clonus. 10. Vital signs. 11. Respiratory assessment. 12. Edema. 13. Provides prenatal education, counseling, and recommendations for A. Nutritional and non-allopathic dietary supplement support. B. Normal body changes in pregnancy. C. Exercise and movement. D. Weight gain in pregnancy. E. Common complaints of pregnancy. 1. Sleep difficulties. 2. Nausea, vomiting. 3. Fatigue. 4. Inflammation of sciatic nerve. 5. Breast tenderness. 6. Skin itchiness. 7. Vaginal yeast infection. 8. Bacterial vaginosis. 9. Symptoms of anemia. 10. Indigestion, heartburn. 11. Constipation. 12. Hemorrhoids. 13. Carpal tunnel syndrome. 14. Round ligament pain. 15. Headache. 16. Leg cramp. 17. Backache. 18. Varicose veins. 19. Sexual changes. 20. Emotional changes. 21. Fluid retention / swelling, edema. E. Recognizes and responds to potential prenatal complications, variations by identifying, assessing, recommending treatment, or referring for 1. Antepartum bleeding, first, second, or third trimester. 2. Pregnancy-induced hypertension. 3. Preeclampsia. 4. Gestational diabetes. 5. Urinary tract infection. 6. Fetus small for gestational age. 7. Fetus large for gestational age. 8. Intrauterine growth retardation. 9. Thrombophlebitis. 10. Oligohydramnios. 11. Polyhydramnios. 12. Breech presentation. A. Identifying breech presentation. B. Turning breech presentation with 1. Alternative positions, tilt board, exercises, etc. 2. Referral for external version. 3. Non-allopathic methods, moxibustion, homeopathic. C. Management strategies for unexpected breech delivery. 13. Multiple gestation. A. Identifying multiple gestation. B. Management strategies for unexpected multiple births. 4. Occiput posterior position. A. Identification. B. Prevention. C. Techniques to encourage rotation. 15. Vaginal birth after cesarean. VBAC. A. Identifies VBAC by history and physical. B. Indications, contraindications for out-of-hospital births. B. Indications, contraindications for out-of-hospital births. C. Management strategies for VBAC. D. Identifies risk factors for uterine rupture. 1. Type of uterine suturing. 2. Uterine incision, classical or transverse. 3. Uterine scar thickness. Page 37, written test specifications continued. 4. Inter-delivery interval. 5. Number of previous cesareans. 6. Previous vaginal births. 7. Implantation site of placenta. 16. Recognizes signs, symptoms of uterine rupture and knows emergency treatment. 17. Preventing preterm birth. A. Risk assessment for preterm birth. 1. Smoking. 2. Vaginal or urinary tract infections. 3. Periodontal health. 4. Prior preterm birth. 5. Other factors. Stress, emotional health. B. Educates and counsels mothers who request early induction of labor. C. Educates for signs of preterm labor. 18. Identifies and deals with preterm labor with A. Referral. B. Consults for preterm labor. C. Treats preterm labor with standard measures. 19. Assesses and evaluates a post-date pregnancy by monitoring, assessing A. Fetal movement, growth, and heart tone variability. B. Estimated due date calculations. C. Previous birth patterns. D. Amniotic fluid volume. E. Maternal tracking of fetal movement. F. Consults or refers for 1. Ultrasound. 2. Non-stress test. B. Biophysical profile. 20. Standard measures for treating a post-date pregnancy. 21. Choleostasis. 22. Conditions from previous pregnancies such as diastasis, prolapse, cytocell, rectocell. 23. Identifies and refers for A. Tubal, molar, or ecoptic pregnancy. B. Placental abruption. C. Placenta previa. 24. Identifies premature rupture of membranes. 25. Manages premature rupture of membranes in a full-term pregnancy. A. Monitors fetal heart tones and movement. B. Minimizes internal vaginal examinations. C. Reinforces appropriate hygiene techniques. D. Monitors vital signs for infection. E. Encourages increased fluid intake. F. Supports nutritional non-allopathic treatment. G. Stimulates labor. H. Consults for prolonged rupture of membranes. I. Reviews Group B strep status and inform of options. 26. Consults and refers for premature rupture of membranes in a preterm pregnancy. 27. Establishes and follows emergency contingency plans for mother-baby. 28. Educates on options for hospital transport, including augmentation and pharmacological pain relief. 29. Cesarean birth. A. Knows local options for cesarean birth. B. Educates on procedures for cesarean birth. C. Provides support before, during, as permitted, and after the cesarean process. D. Follows up for cesarean birth, including 1. Physical healing. 2. Emotional healing. 3. Breastfeeding and infant care after cesarean birth. 5. Labor, birth, and immediate postpartum. 35% of exam, 99 to 111 examination items. A. Understands and supports the normal physiological process of labor and birth. B. Understands the relationship of maternal and fetal anatomy in relation to labor and birth. Page 38. Continued. Written test specifications continued. C. Facilitates maternal relaxation and provides comfort measures throughout labor. 1. Applies knowledge of emotional and psychological aspects of labor to provide support. 2. Applies knowledge of physical support in labor, counter pressure, position changes, massage, water, etc. 3. Water birth. A. Educates on benefits and risks of water birth. B. Equips the birth site for a water birth. C. Discusses specific management of complications during water birth. D. Recognizes and counsels on signs of early labor and appropriate activities. E. Assesses maternal and infant status based on 1. Vital signs, 2. Food and fluid intake, 3. Status of membranes, 4. Uterine contractions, frequency, duration, intensity, 5. Fetal heart tone, 6. Fetal lie, presentation, position, and descent, 7. Cervical effacement and dilation. F. Assesses and supports normal progress of labor. G. Recognizes and responds appropriately to conditions that slow or stall labor, such as 1. Anterior swollen lip, 2. Posterior or asynclitic fetal position, 3. Pendulous belly inhibiting descent, 4. Maternal exhaustion, 5. Maternal fears, emotions, 6. Abnormal labor patterns, 7. Deep transverse arrest, 8. Obstructed labor, 9. Advises on non-allopathic remedies, nipple stimulation, herbs, positions, movement, etc. H. Recognizes, prevents, or treats maternal dehydration. I. Recognizes and responds to labor and birth complications such as 1. Abnormal fetal heart tones and patterns, 2. Cord prolapse, 3. Recognizes and responds to variations in presentations such as A. Breech, 1. Understands mechanisms of descent and rotation for complete, frank, or footling breech presentation, 2. Techniques for release of nuchal arms with breech. B. Nuchal hand/arm, 1. Applies counter pressure to hand or arm and perineum, 2. Sweeps arm out. C. Nuchal cord, 1. Loops finger under cord sliding over head or shoulder, 2. Clamps and cuts cord, 3. Presses baby's head into perineum and somersaults the baby out, 4. Prepares for possible resuscitation. D. Face and brow, 1. Mechanism of delivery for face or brow presentation, 2. Determines position of chin, 3. Management strategies for face or brow presentation, 4. Prepares for resuscitation or treatment of bruising, swelling, eye injury, 4. Multiple birth and delivery. A. Identifies multiple gestation. B. Consults or transports according to plan. C. Prepares for attention to more than one. 5. Shoulder dystocia. A. Applies gentle traction while encouraging pushing. B. Repositions the mother to 1. Hands and knees, Gaskin maneuver. 2. Exaggerated lithotomy, McRoberts position. 3. End of bed. 4. Squat. C. Repositions shoulders to oblique diameter. Page 39. Written test specifications continued. D. Shifts pelvic angle with lunge or runner's pose. E. Extracts posterior arm. F. Flexes shoulders of newborn, then corkscrews. G. Applies suprapubic pressure. H. Sweeps arm across newborn's face. I. Fractures baby's clavicle. 6. Indications for performing an episiotomy. 7. Management of meconium-stained fluids. A. Recognizes and assesses degree of meconium. B. Follows standard resuscitation procedures for meconium. 8. Management of maternal exhaustion. A. Hydration and nutrition. B. Rest, bath, removal of distractions. C. Monitors maternal and fetal vital signs, including urine ketones. D. Evaluates for consultation or referral. 9. Recognizes, consults, transports for signs of A. Uterine rupture. B. Uterine inversion. C. Amniotic fluid embolism. D. Stillbirth. J. Evaluates and supports during second stage. 1. Recognizes and assesses progress in second stage. 2. Supports maternal instincts in pushing techniques and positions. 3, recommends / suggests pushing techniques and positions when needed. 4, monitors vital signs, understands normal and abnormal changes. 5, facilitates supportive environment and family involvement. 6, prepares necessary equipment for immediate access. 7, uses appropriate hand techniques for perineal support and birth of baby. K, assesses condition and provides immediate care of newborn. 1, understands, recognizes, and supports normal newborn adjustment at birth. A, keeps mother and baby warm and together for initial assessment. B, determines APGAR score at 1 minute, 5 minutes, and if needed, at 10 minutes. C, monitors respiratory and cardiac function by assessing 1, symmetry of chest, 2, sound and rate of heart tones and respirations, 3, nasal flaring, 4, grunting, 5, chest retractions, C, circumferal cyanosis, 7, central cyanosis, D, stimulates newborn respiration according to AAP / NRP recommendations, E, encourages parental touch and speech while keeping baby warm, 2, responds to need for newborn resuscitation according to AAP NRP recommendations, 3, recognizes and consults or transports for apparent birth defects, 4, recognizes signs and symptoms of meconium aspiration syndrome and consults or transports, 5, provides appropriate care of the umbilical cord. A, clamps and cuts cord after pulsing stops. B, evaluates the cord including number of vessels. C, collects cord blood sample if needed. C, assesses gestational age. 7, assesses for central nervous system disorder. L, recognizes and responds to normal third stage, including physiological and active management strategies. 1, determines signs of placental separation such as A, separation gush, B, contractions, C, lengthening of cord, D, urge to push, E, rise in fundus. Page 40, written test specifications continued. 2, facilitates delivery of the placenta by A, breastfeeding nipple stimulation, B, changing maternal position, C, performing guarded cord traction, D, emptying the bladder, E, administering non-allopathic treatments, F, encouraging maternal awareness, G, manual removal, H, transport for removal. M, assesses condition of placenta and membranes, recognizes normal and abnormal characteristics. N, estimates and monitors ongoing blood loss. 1, responds to a trickle bleed by A, assesses origin. B, assesses fundal height and uterine size. C, fundal massage. D, assesses vital signs. E, emptying bladder. F, breastfeeding or nipple stimulation. G, expressing clots. H, non-allopathic treatments. O, responds to postpartum hemorrhage with 1, fundal massage. 2, external bimanual compression. 3, internal bimanual compression. 4, manual removal of clots. 5, administering medications. 6, non-allopathic treatment. 7, increasing maternal focus and participation. 8, administering or referring for IV fluids. 9, consulting and or transfer. Activating emergency backup plan. 10, treating for hypovolemic shock according to standard recommendations or protocols. 11, performing external aortic compression. P, assesses general condition of mother. 1, assesses for bladder distension. A, encourages urination. B, performs catheterization if needed. 2, assesses condition of vagina, cervix, and perineum. 4A, cystocele. B, rectocele. C, hematoma. D, hemorrhoids. E, bruising. F, prolapsed cervix or uterus. G, tears, lacerations. 1, assesses blood color and volume. Identifies source. 2, applies direct pressure on tear. 3, clamps vessel if identified. 4, sutures first or second degree or labial tears. 5, administers local anesthetics. 6, performs suturing according to standard procedures and protocols. 7, provides alternative repair methods, non-suturing. 3, provides instructions on care and treatment of perineum. 4, monitors maternal vital signs after birth. 5, provides timely food and drink. Q, facilitates breastfeeding by assisting and teaching about 1, colostrum. 2, positions for mother and baby. 3, skin to skin contact. 4, latching on. 5, maternal hydration and nutrition. 6, maternal rest. 7, feeding patterns. 8, maternal comfort measures for engorgement. 9, letdown reflex. 10, milk expression. 11, normal newborn urine and stool output. R, performs a newborn exam by assessing for normal and abnormal. 1, assesses the head for A, size circumference. B, molding. C, hematoma. D, caput. E, suture lines. F, fontanelles. 2, assesses the eyes for A, jaundice. B, pupil conditions. C, tracking. Written test specifications continued, page 41. D, spacing. E, clarity. F, hemorrhage. G, discharge. H, red eye reflex. 3, assesses the ears for A, positioning. B, response to sound. C, patency. D, cartilage. 4, assesses the mouth for A, appearance and feel of palate. B, lip and mouth color. C, tongue. D, lip cleft. E, signs of dehydration. F, tongue and lip tie. F, assesses the nose for A, patency. B, flaring nostrils. C, assesses the neck for A, enlarged glands, thyroid and lymph. B, trachea placement. C, soft tissue swelling. D, unusual range of motion. 7, assesses the clavicle for A, integrity. B, symmetry. 8, assesses the chest for A, symmetry. B, nipples. C, breast enlargement or discharge. D, measurement, chest circumference. E, heart sounds, rate, and irregularities. 9, auscultates the lungs front and back for A, breath sounds. B, equal bilateral expansion. 10, assesses the abdomen for A, enlarged organs. B, masses. C, hernias. D, bowel sounds. E, rigidity. 11, assesses the groin for A, femoral pulses. B, swollen glands. 12, assesses the genitalia for A, appearance. B, position of urethral opening. C, testicles for 1, descent. 2, rugae. 3, herniation. D, assesses the labia for 1, patency. 2, maturity of clitoris and labia. E, assesses the rectum for 1, patency. 2, meconium. 13, assesses abduct hips for dislocation. 14, assesses the legs for A, symmetry of creases in the back of legs. B, equal length. C, foot ankle abnormality. 15, assesses the feet for A, abnormalities. B, digits, number, webbing. C, creases. 16, assesses the arms for symmetry in A, structure. B, movement. 17, assesses the hands for A, digits, number, webbing. B, finger tapers. C, palm creases. D, length of nails. 18, assesses the backside of the baby for A, symmetry of hips, range of motion. B, condition of the spine. 1, dimpling. 2, holes. 3, straightness. 19, assesses flexion of extremities and muscle tone. 20, assesses reflexes. A, sucking. B, Morrow. C, Babinski. D, plantar palmar. E, stepping. F, grasping. G, rooting. Page 42, written test specifications continued. H, blinking. 21, assesses skin condition for A, color. B, lesions. C, birthmarks. D, malia. E, vernix. F, lanugo. G, peeling. H, rashes. I, bruising. G, Mongolian spots. 22, assesses length of baby. 23, assesses weight of baby. 24, assesses temperature of the baby. S, assesses gestational age of the baby. T, administers eye prophylaxis with informed consent of parents. U, administers vitamin K with informed consent of parents. V, reviews Group B strep status and signs or symptoms and plans for follow-up. 6, Roman numeral 6. Postpartum, 15% of exam, 39 to 51 items. A. Assesses and evaluates physical and emotional changes following childbirth, including normal process of involution. B. Assesses and evaluates normal or abnormal conditions of mother or baby at 1. Day 1 to day 2, 2. Day 3 to day 4, 3. 1 to 2 weeks, 4. 3 to 4 weeks, 5. 5 to 6 weeks. C. Assesses and provides counseling and education for 1. Postpartum subjective history, 2. Lochia versus abnormal bleeding, 3. Return of menses, 4. Vital signs, digestion, elimination patterns, 5. Muscle prolapse of vagina and rectum, cystocele, rectocele, 6. Condition and strength of pelvic floor, 7. Condition of uterus, size and involution, ovaries and cervix, 8. Condition of vulva, vagina, perineum, and anus, 9. Facilitates psychosocial adjustment. A. Recognizes and responds to mild postpartum depression. B. Counsels for appropriate support from family and friends. Increases home or phone visits as needed. D. Recognizes and responds to increased severity of postpartum depression or psychosis. E. Counsels client and family on resources for depression, increases follow-up. D. Knows signs and symptoms, differential diagnosis, and appropriate midwifery management or referral for 1. Uterine infection, 2. Urinary tract infection, 3. Infection of vaginal tear or incision, 4. Postpartum bleeding, hemorrhage, 5. Thrombophlebitis, 7. Separation of abdominal muscles, 7. Separation of symphysis pubis, 8. Postpartum preeclampsia. E. Evaluates and counsels for newborn jaundice. 1. Refers or consults for jaundice in the first 24 hours after birth. 2. Evaluates, counsels, and monitors for physiological jaundice after 24 hours. 3. Encourages mother to breastfeed every 2 hours. 4. Exposes front and back of newborn to sunlight through window glass. 5. Assesses and monitors newborn lethargy and hydration. 6. Consults or refers for increased symptoms. F. Provides direction for care of circumcised penis. G. Provides direction for care of intact, uncircumcised penis. H. Breastfeeding care and counseling. 1. Educates regarding adverse factors affecting breastfeeding or breast milk. A. Environmental. B. Biological. C. Occupational. D. Pharmacological. Page 43, written test specifications continued. 2. Evaluates baby's sucking method, position of lips and tongue. 3. Evaluates conditions of breast and nipples. 4. Treats sore nipples. A. Exposure to air. B. Alternates nursing positions. C. Applying topical agents. D. Applying express breast milk. E. Flange of lips. F. Latch on. G. Tongue tie. H. Sucking. I. Swallowing. 5. Treats thrush on nipples. A. Dries nipples after nursing. B. Non-allopathic remedies. C. Allopathic treatments. 6. Treats mastitis by A. Provides immune support including 1. Nutrition/hydration. 2. Non-allopathic remedies. B. Encourages multiple nursing positions. C. Applies herbal non-allopathic compresses. D. Applies warmth, soaking in tub or by shower. E. Encourages adequate rest relaxation. F. Assesses for signs and symptoms of infection. G. Teaches mother to empty breast at each feeding. H. Provides or teaches gentle massage of sore spots. I. Consults or refers to breastfeeding support groups, lactation counselor, or other healthcare providers. I. Provides contraceptive and family planning education, counseling, and referrals. J. Provides opportunity for verbal and written feedback from client. 7. Well baby care, 5% of exam, 12 to 18 items. Roman numeral 7, VII or V11. VII. A. Provides newborn care up to 6 weeks. B. Principles of newborn adaptation to extrauterine life. Physiologic changes in pulmonary and cardiac systems. 1. Basic needs of newborn: breathing, warmth, nutrition, and bonding. 2. Normal, abnormal newborn activity, responses, vital signs, appearance, behavior, etc. 3. Normal growth and development of the newborn and infant. C. Assesses the current health and appearance of baby, including 1. Temperature, 2. Heart rate, rhythm, and regularity. 3. Respirations. 4. Appropriate weight gain. 5. Length. 6. Measurement of circumference of head. 7. Neuromuscular response. 8. Level of alertness. 9. Wake sleep cycles. 10. Feeding patterns. 11. Urination and stool for frequency, quantity, and color. 12. Appearance of skin. 13. Jaundice. 14. Condition of cord. D. Understands, respects, and counsels on traditional or cultural practices related to the newborn. E. Advises mother in care of 1. Diaper rash. 2. Cradle cap. 3. Heat rash. 4. Colic. 5. Cord care. F. Recognizes signs, symptoms, and differential diagnosis of 1. Infections. 2. Cardiorespiratory abnormalities. 3. Glucose disorders. 4. Birth defects. 5. Failure to thrive. Page 44. Written test specifications continued. 6. Newborn hemorrhagic disease, early and late onset. 7. Polycythemia. 8. Non-accidental injuries. 9. Dehydration. G. Evaluates, counsels, and monitors for physiological jaundice after 24 hours. 1. Encourages mother to breastfeed every 2 hours. 2. Exposes front and back of newborn to sunlight through window glass. 3. Assesses and monitors newborn lethargy and hydration. 4. Consults or refers for additional screening and or treatment. H. Provides information for referral for continued well baby care. 1. Performs or refers for newborn metabolic screening. 2. Performs or refers for hearing screening. 3. Performs or refers for pulse oximetry, newborn screening for congenital heart disease, CCHD. 4. Educates about referral for integrative, complementary, alternative practitioners. 5. Educates about options for pediatrician or family practitioner. 6. Educates about healthcare providers for immunizations or non-immunizations. I. Supports and educates parents during grieving process for loss of pregnancy, stillbirth, congenital birth defects, or neonatal death. J. Supports and educates parents of newborns transferred to hospital or with special needs. K. Supports integration of baby into family. Page 45, written test specifications continued. Example of a knowledge question. The knowledge question requires a candidate to answer the question solely by memory and involves the recall of definitions, facts, rules, sequences, procedures, principles, and generalizations. Constipation can be treated with A. Calcium, warm, moist heat, and exercise. B. Acupressure wristband, frequent small meals, and protein-rich snacks. C. Vitamin E, support stockings, and elevated legs. D. Increased water, exercise, and natural sources of iron. Answer D. Constipation can be treated with increased water, exercise, and natural sources of iron. Example of an application question. The application questions involve the use of abstracts in concrete situations. The abstractions may be in the form of general ideas, procedures, or methods. They may also be in the form of technical principles, ideas, and theories that must be remembered or applied. What do white spots on the infant's tongue and gums that can be easily removed indicate? A. Strep throat. B. Milk residue. C. Thrush. D. Milk tolerance. Answer equals B. White spots on the infant's tongue and gums that can be easily removed indicate milk residue. Example of an analysis question. The analysis question requires a candidate to break down information into its constituent parts. This may involve finding assumptions, distinguishing facts from opinion, discovering causal relationships, and finding fallacies in stories or arguments. A mother who gave birth 2 weeks ago calls to report that this morning she awakened with a fever of 103 Fahrenheit, chills, a headache, and body aches. What is the most likely cause of these symptoms? A. Laceration infection. B. Uterine infection. C. Breast infection. D. Respiratory infection. Answer C. Breast infection is the most likely cause of a mother running a fever with chills, headache, and body aches. Page 46, written examination reference list. Code Jane, Anatomy and Physiology for Midwives, Churchill Livingstone, 3rd edition, 2011. Davis, Elizabeth, Heart and Hands, A Midwife's Guide to Pregnancy and Birth, 5th edition, 10-Speed Press, 2012. Professional Ethics in Midwifery Practice. Foster, Alyssa, and Lasser, John, Jon. Fry, Anne, Holistic Midwifery, a comprehensive textbook for midwives and home birth practice, Volume 1, Care During Pregnancy. Fry, Anne, Holistic Midwifery, a comprehensive textbook for midwives and home birth practice, Volume 2, Care During Labor and Birth, Labrise Press, 2nd edition, 2013. Fry, Anne, Healing Passage, 6th edition, Labrise Press, 2010. Fry, Anne, Understanding Diagnostic Test in the Childbearing Year, 7th edition, Labrise Press, 2007. Gaskin, Ina May, Spiritual Midwifery, 4th edition, The Book Publishing Company, 2002. Gruenberg, Bonnie, Birth Emergency Skills Training, Birth Guru Publications, 2009. Miles, Margaret, Fraser, Cooper, Textbook for Midwives, Elsevier, 16th edition, 2014. Oxworn and Foote, Human Labor and Birth, 6th edition, McGraw-Hill, 2013. Williams, Obstetrics, 23rd edition, McGraw-Hill, 2014. Mobracher, Nancy, or Moorbacher, Nancy, Breastfeeding Answers Made Simple, Hale Publishing, 2010. Sinclair, Constance, A Midwife's Handbook, Saunders, 2004. Snell, BJ and Gardner, Sandra, Care of the Well Newborn, Jones and Bartlett, 2017. Varney, Helen, Midwifery, Jones and Bartlett, 5th edition, 2014. Weaver, Pam and Evans, Sharon, Practical Skills Guide for Midwives, Morningstar Publishing, 5th edition, 2012. American Academy of Pediatrics, Neonatal Resuscitation Textbook, 7th edition, 2016. For testing purposes, when checking off comprehensive skills, knowledge, and abilities essential for competent midwifery practice, Verification Form 201, use the specific techniques as described in the Practical Skills Guide for Midwifery and the NARM'S Candidate Information Booklet. Page 47, Midwives Alliance of North America Core Competencies, adopted by the Midwives Alliance Board, October 3, 1994. Revisions by committee, adopted by the Midwives Alliance Board, August 4, 2011. Guiding Principles of Practice. The midwife provides care according to the following principles. Pregnancy and childbearing are natural, physiologic life processes. Women have within themselves the innate biological wisdom to give birth. Physical, emotional, psychosocial, and spiritual factors synergistically shape the health of individuals and affect the childbearing process. The childbearing experience and birth of a baby are personal, family, and community events. The woman is the only direct care provider for herself and her unborn baby. Thus, the most important determinant of a healthy pregnancy is the mother herself. The parameters of normal vary widely, and each pregnancy, birth, and baby is unique. I. General knowledge and skills. The midwife's knowledge and skills include, but are not limited to, A. Communication, counseling, and education before pregnancy and during the childbearing year. B. Human anatomy and physiology, especially as relevant to childbearing. C. Human sexuality. D. Various therapeutic health care modalities for treating body, mind, and spirit. E. Community health care, wellness, and social service resources. F. Nutritional needs of the mother and baby during the childbearing year. G. Diversity, awareness, and competency as it relates to childbearing. The midwife maintains professional standards of practice, including but not limited to A. Principles of informed consent and refusal and shared decision-making. B. Critical evaluation of evidence-based research, findings, and application to best practices. C. Documentation of care throughout the childbearing cycle. D. Ethical considerations relevant to reproductive health. E. Cultural sensitivity and competency. F. Use of common medical terms. G. Implementation of individualized plans for woman-centered midwifery care that support the relationship between the mother, the baby, and their larger support community. H. Judicious use of technology. I. Self-assessment and acknowledgement of personal and professional limitations. 2. Care during pregnancy. The midwife provides care, support, and information to women throughout pregnancy and determines the need for consultation, referral, or transfer of care as appropriate. The midwife has knowledge and skills to provide care that include but are not limited to A. Identification, evaluation, and support of mother and baby well-being throughout the process of pregnancy. B. Education and counseling during the childbearing cycle. C. Identification of pre-existing conditions and preventative or supportive measures to enhance client well-being during pregnancy. D. Nutritional requirements of pregnant women and methods of nutritional assessment and counseling. E. Emotional, psychosocial, and sexual variations that may occur during pregnancy. F. Environmental and occupational hazards for pregnant women. G. Methods of diagnosing pregnancy. H. The growth and development of the unborn baby. I. Genetic factors that may indicate the need for counseling, testing, or referral. J. Indications for and risks and benefits of biotechnical screening methods and diagnostic tests used during pregnancy. K. Anatomy, physiology, and evaluation of the soft and bony structures of the pelvis. L. Palpation skills for evaluation of the baby and the uterus. M. The causes, assessment, and treatment of the common discomforts of pregnancy. Page 48, Manacor competencies continued. N. Identification, implications, and appropriate treatment of various infections, disease, conditions, and other problems that may affect pregnancy. O. Management and care of the Rh-negative woman. P. Counseling to the woman and her family to plan for a safe, appropriate place for birth. 3. Care during labor, birth, and immediately thereafter. The midwife provides care, support, and information to women throughout labor, birth, and the hours immediately thereafter. The midwife determines the need for consultation, referral, or transfer of care as appropriate. The midwife has knowledge and skills to provide care that include but are not limited to A. The processes of labor and birth. B. Parameters and methods including relevant health history for evaluating the well-being of mother and baby during labor, birth, and immediately thereafter. C. Assessment of the birthing environment to assure that it is clean, safe, and supportive and that appropriate equipment and supplies are on hand. D. Maternal emotional responses and their impact during labor, birth, and immediately thereafter. E. Comfort and support measures during labor, birth, and immediately thereafter. F. Fetal and maternal anatomy and their interrelationship as relevant to assessing the baby's position and the progress of labor. G. Techniques to assist and support the spontaneous vaginal birth of the baby and placenta. H. Fluid and nutritional requirements during labor, birth, and immediately thereafter. I. Maternal rest and sleep as appropriate during the process of labor, birth, and immediately thereafter. J. Treatment for variations that can occur during the course of labor, birth, and immediately thereafter, including prevention and treatment of maternal hemorrhage. K. Emergency measures and transport for critical problems arising during labor, birth, or immediately thereafter. L. Appropriate support for the newborn's natural physiologic transition during the first minutes and hours following birth, including practices to enhance mother-baby attachment and family bonding. M. Current biotechnical interventions and technologies that may be commonly used in a medical setting. N. Care and repair of the perineum and surrounding tissues. O. Third stage management, including assessment of the placenta, membranes, and umbilical cord. P. Breastfeeding and lactation. Q. Identification of pre-existing conditions and implementation of preventative or supportive measures to enhance client well-being during labor, birth, the immediate postpartum, and breastfeeding. 7. Postpartum care. 8. Roman numeral 8. Postpartum care. The midwife provides care, support, and information to women throughout the postpartum period and determines the need for consultation, referral, or transfer of care as appropriate. The midwife has knowledge and skills to provide care that include but are not limited to A. Anatomy and physiology of the mother. B. Lactation support and appropriate breast care, including treatments for problems with nursing. C. Support of maternal well-being and mother-baby attachment. D. Treatment for maternal discomforts. E. Emotional, psychosocial, mental, and sexual variations. F. Maternal nutritional needs during the postpartum period and lactation. G. Current treatments for problems such as postpartum depression and mental illness. H. Grief counseling and support when necessary. I. Family planning methods as the individual woman desires. Page 49, Mana Core Competencies continued. 9. Roman numeral 9. Newborn care. The midwife provides care to the newborn during the postpartum period, as well as support and information to parents regarding newborn care and informed decision-making, and determines the need for consultation, referral, or transfer of care as appropriate. The midwife's assessment, care, and shared information include but are not limited to A. Anatomy, physiology, and support of the newborn's adjustment during the first days and weeks of life. B. Newborn wellness, including relevant historical data and gestational age. C. Nutritional needs of the newborn. D. Benefits of breastfeeding and lactation support. E. Laws and regulations regarding prophylactic biotechnical treatments and screening tests commonly used during the neonatal period. F. Neonatal problems and abnormalities, including referral as appropriate. G. Newborn growth, development, behavior, nutrition, feeding, and care. H. Immunization, circumcision, and safety needs of the newborn. 10. Roman numeral 10. Well-woman care and family planning. The midwife provides care, support, and information to women regarding their reproductive health and determines the need for consultation or referral by using a foundation of knowledge and skills that include but are not limited to A. Reproductive health care across the lifespan. B. Evaluation of the woman's well-being, including relevant health history. C. Anatomy and physiology of the female reproductive system and breast. D. Family planning and methods of contraception. E. Decision-making regarding timing of pregnancies and resources for counseling and referral. F. Preconception and interconceptual care. G. Well-woman gynecology as authorized by jurisdictional regulations. 11. Roman numeral 11. Professional, legal, and other aspects of midwifery care. The midwife assumes responsibility for practicing in accordance with the principles and competencies outlined in this document. The midwife uses a foundation of theoretical knowledge, clinical assessment, critical thinking skills, and shared decision-making that are based on A. MANA's essential documents,